the ways, the metrics that you demonstrate that this is a better solution. Could you get into that a little bit? Maybe two or
Yeah,
three of the most robust metrics?
absolutely. And metrics is key. And we launched up in the Toronto area initially, then uh, in 2000, yeah, last year, 2024. Again, my years mixed up. 2024, we launched in the US, in Wisconsin. And by August, about 7 months after launch, we had already started to show decreased length of stay, decreased readmissions, as an example, when we're involved compared to when they're going to a non-home care hub home. So I presented that to the Wisconsin Hospital Association in tandem with our health system partner, the Freighter Health System, which is Medical College of Wisconsin, last year. So that's a couple of key metrics, of course.
Yes. And I'd be interested to know if not only Freighter, but perhaps other interested clients that you talk about what you could do for them in the context of their value-based care contracts. Because if you are materially reducing readmissions, then that's typically one of the metrics in those kinds of contracts that are the most weighted in terms of, the bonuses that the provider side can get by preventing those readmissions within a certain period.
Yeah, absolutely. And that's exactly where we're going. Measurement is key. Being able to take care of really hard patients. And that's really what our focus is. A lot of times people will almost lie to us when they refer to a patient to us, which is not good. They'll say, or they'll leave out information. And this happens a lot in the post-acute world because it's hard to get people out. So sometimes there's not always transparent information, nursing assessments, et cetera. We encourage people, just tell us. We're not going to reject this referral just because they're hard, because we're designing a system to take really hard patients. We have some of our partner operators on our platform who take the hardest people coming out of jails and they've had no readmissions, et cetera, in 2 years. We want to take that, but we have to know so we can make sure the supports are in place so that we can put them in the right environment where they will thrive. But we have to have all that information. And when that happens, we're measuring all this out over the next couple of years, and we'll have more and more data to show. And to your point, there's a significant savings for all these health systems and payers if we continue to provide better care and better outcomes. But what we've done is we've created the system so efficiently that even if our outcomes were the same, we're still going to save them actually a tremendous amount of money because of the way that we've set up our system in terms of our operational efficiencies.
From the length of stay standpoint.
Yeah, well, not even that, just from the cost. Our cost tends to be about 30% lower than a traditional